All right. Hello, everyone. I think we should take the advice of the video and all get up. Let's all just get up. Yeah. So my name is Erin. I just wanted to start by saying how honored I am to present at this conference on behalf of the Yoga Project team. Myself, Barry, Jaisal, and Leticia, who are also here today and will be helping me at my breakout session and in tomorrow's yoga class. So just take a nice big breath in, lift your arms up over your head. Good, and exhale, let your hands go down. Good, nice big breath in again. Good, nice exhale. Hamelamote, Hamelakonte. And we're just going to do a little side bending as too. Just make sure to take care knowing your own physiology and what feels good in your body, feels best for your body. So just a little bit of a side bend. Everybody give a shimmer to this hand. This hand, mirror me, mirror me. Great, take a nice big breath in. And we're going to lean over in that direction. Good, and then Hamelakonte, come back. Good, and then this hand, up to the sky. Hamelamote, lean. Hamelakonte. All right, come on and sit back down. We all needed just a little bit of that, right? All right, now I'm going to get you to move your chair back a little bit. Good, and you have the choice to either come to the front of your seat. These chairs are a little low, so you might find that staggering your feet, putting one foot in front of the other and the other just slightly behind, kind of putting the toe on the ground, makes it a little bit easier to sit well at the front of the seat. Or sit at the back of your seat and scooch your bum back, 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 and then bring your back away from the back of the chair a little bit. Great. And now we're going to all take another nice big breath in. And a breath out. And you can either close your eyes or soften your gaze, meaning make it just gentle and maybe look at your water glass. So either close the eyes or look at the water glass. And I want you to notice the sounds of the room, the sounds around you. They might be very subtle, but just start to bring them in. And the mind might drift, and that's okay. It's its normal function. Just bring it back to the sounds. And then I want you to start to notice your body, particularly your feet on the ground. And maybe your bum on your seat. Your hands on your legs. Maybe even your clothing on your body. And then draw your attention to your breath, how it might feel cool at your nose as you breathe in, and warm at your nose as you breathe out. How your belly moves when you breathe. Starting to think in when you breathe in, and out when you breathe out. And then bring your attention back to your body. And back to the sounds in the room. Hamelamote, Hamelakonte, and open your eyes. So welcome. All right, now I have to figure out how to do this thing. There we go. So yoga is the practice of mindfulness. Oh, I have to do this too, right? Mindfulness, breathing, in postures or movement. Good. Mindfulness practices, these are based in long-standing Eastern philosophical practices, and they are secular, so they're available as a container for all belief systems. And they include concentration on breath, which we just did, an awareness of the environment, body scans, awareness of pain and non-pain areas of the body, focusing on objects sometimes, or repeated thoughts or affirmations, as well as imagination work. And the goals of mindfulness work are to harness awareness and observation of the current state of the body, the environment inside and outside of the body and mind experience, in hopes of reducing stress and increasing self-efficacy. Breath exercises use observation, breath pacing, concentration, expansion and control, awareness. And the goals are stress reduction and pain management, increased awareness, diaphragmatic control and elasticity, increased range of motion and strength in secondary breathing musculature, increased oxygenation potential, as well as heart rate variability work, and this is specific to the research that's coming out more and more around breath pacing techniques. Movement exercises are the poses or postures, mindful movement with breath, weight-bearing isometric contractions with a focus on postural alignment and good habitual movement patterns and biomechanics. And the goals are increased strength and range of motion, as well as body awareness, increase in proprioception, and instilling healthy movement patterns. And then there's this fourth element, and that's the element of community. Whether it's teacher, doctor, to student, patient, or a group of people gathering to do these practices together, yoga creates community, which is in part, it's part of many of the studies that I'm going to share with you, and is fundamental to the World Spine Care Yoga Project. And the goal is psychosocial support. So this is within the biopsychosocial model. Yoga, as a word of Sanskrit, which is where it comes from, means to yoke, so to bring together. And all of the research that I'm about to present brings all of these elements together. All right. So why yoga for chronic low back pain and other musculoskeletal pain? There's evidence to support the claims. Therapies addressing, oh no, make it work. Oh yay, thank you. Therapies addressing physical, psychosocial, and emotional dimensions may be more helpful than treatments addressing only one dimension. Oh, that's because I'm doing it on one hand and not on the other. Oh, I did it again. Oh, there we go. Yoga is a biopsychosocial longitudinal self-care strategy. Physical activity has known benefits for chronic low back pain, and yoga reduces maladaptive movements and postures, and it assists in soft tissue remodeling. So most of these trials are looking at pain, function, and quality of life outcomes. There we go. Brain's working in two hands. So RTCs for non-specific chronic low back pain were reviewed. There were 6 large and 6 smaller. There was 5 reviews. There we go, 5 reviews, 1 meta-analysis. There were at least 3 large studies in progress in 2016, and 2 of those were using veterans. Recommendations for chronic low back pain in 2 guidelines, and at least 1 meta-analysis or review for mindfulness and meditation for chronic pain. So some of the key points from some of these studies is for chronic low back pain, 1 trial found Iyengar yoga associated with lower pain scores versus usual care at 24 weeks. For chronic low back pain, a systematic review found yoga associated with lower pain intensity and better function versus exercise, so straight exercise alone, though the effects were small and differences were not always statistically significant. For chronic low back pain, yoga was associated with lower short-term pain intensity versus education, but effects were smaller and not statistically significant at longer-term follow-ups. Yoga was also associated with better function in the short term. And I just want to note here that in all the studies that I have read personally, The short-term studies were taken after the yoga practices were done in community. Some did include some takeaway exercises to do at home. And then the short term was taken at that point, and then the long term was taken when everyone was sent home to do stuff on their own. So we all know what happens in studies when that happens, and that's also happened with these. But I also I personally find it interesting around the idea of community and the biopsychosocial model. So some of the primary outcomes from the meta-analysis, and just some things to think about as I let you know about the primary and secondary outcomes, is mood and self-efficacy are related to chronic low back pain. Low self-efficacy is a psychosocial risk factor, and depression is correlated in chronic low back pain in general. So from Kramer, in the short term, yoga reduced pain, there we go, improved back-related functional disability, and improved quality of life. In the longer-term follow-ups, moderate evidence that yoga reduced pain and improved back-related functional disability. Oop, there we go. There we go. Oh. There we go. Awesome, thank you. So, several RCTs of patients with chronic low back pain found that the yoga group showed improvements in mood and self-efficacy. Increased activity and passive range of motion when assisting lumbar spine flexibility and straight leg raise test, respectively, was also reported. So stress, anxiety, depression, and sleep disturbances are correlated with low back pain. And there's evidence for effectiveness in these areas. Also, thickening in areas of the brain associated with pain tolerance, and increased levels in GABA, the main inhibitory transmitter of the brain. And in the mindfulness meditation for chronic pain meta-analysis of RCTs, the authors found that there was small but statistically significant improvements in pain versus comparison groups, and higher results in depression symptoms and quality of life. It was the recommendation by the authors of the review that there needs to be more rigorous, large-scale RCTs to prove estimates of the efficacy of mindfulness meditation in chronic pain. So a lot of it is looking at the differences between acute and chronic pain. So more studies, more studies, more studies. So my overall conclusions are, these studies strongly suggest that yoga has an important role to play in the management of non-specific chronic low back pain for adults who are willing to practice yoga. There is limited evidence for acute pain or specific causes of back pain, such as that relate to stenosis, disc herniation, or chronic low back pain related to special populations. Again, we're looking at the acute pain in that. For patients, practicing yoga one time a week may be enough to provide relief from chronic low back pain to a certain extent. And strong evidence for yoga and improved quality of life and decreased insomnia, depression, stress, and anxiety. So specifically within the biopsychosocial model. So our hypothetical model is that yoga, which is mindfulness, breath, and postures, has the capacity to increase physical activity, increase range of motion, improve mood and quality of life, decrease stress and anxiety, improve focus on self-care, and improve sleep patterns. Oh, lovely, lovely sleep. Which could then decrease back pain and other musculoskeletal pain. So now the question is, with this hypothesis and a growing body of evidence, how is World Spine Care incorporating yoga into its offerings and clinical structures around the world? World Spine Care has created a yoga teacher training program to be implemented in association with our clinics. It's been implemented at the Mahalape and Shoshone World Spine Care clinics to offer yoga to patients and communities by community members, and I find this fundamentally important. So what is the World Spine Care Yoga Project? Our mission is to support the global mission of World Spine Care by empowering individuals to share the practices of yoga. And our vision is that everyone, everywhere has access to the practices of yoga as a tool for active self-care and pain management strategies. This capacity building initiative has enabled members of the community to teach classes in the local language and cultural context thus ensuring the relevance and success of the yoga project, while at the same time providing a potential income and community building skill for the participants, as well as building autonomy within their own wellness. And this is huge, and we just learned this when we were in Mahalape and Shoshone, as an active self-care and pain management regimen for themselves. So level 1 has been running in Shoshone and Mahalape clinics since 2016, and it has a focus on people with low mobility who have trouble getting up and down off the ground, working with seated postures, and with chair-assisted postures. We've had the most success in the Shoshone clinic. The women who are teachers in the Shoshone clinic have been teaching bi-weekly classes of 5 to 20 community members, and it depends on the season, and it depends how much clinical time World Spine Care is having at that location. And in Mahalape, we had a big learning curve. We learned that fundamentally we need to train patients who themselves can benefit directly from the practices. And if we are training younger people or people who do not have limited mobility, we need people who are very, very interested in community programs. And we have had great success with younger people as well. So as we continue to learn in this model, we are starting to rename some of the poses that we do, even some of the breaths that we do, to honor the cultural context from which we come. So this pose used to be called eagle pose, and now it's called crocodile. So let's try it. So take this hand, put it on this shoulder, take this hand, put it on your armpit, and then shut the jaws. Good. And then it's breathing between the shoulders, lifting the elbows high, like you're looking down the nose of your own crocodile. Yeah. Great. And then let that go. Good. There's also a really fun one called cat-cow, which is now called kokokatse. Kokokatse. And we're also being a batabane, hunting kudu, when we do this pose. So we're having fun with our program and letting it expand and teach us within our community building within Botswana as well. So level 2 is for higher mobility, higher levels of mobility, and lower levels of chronic pain, incorporating more standing postures supported by the chair or free from the chair. In Shoshone, we just completed level 2. Here are 5 of the 9 level 2 graduates. Our level 2 participants include our original 5 teachers from Shoshone, so now they're doing free from the chair postures, or chairs that are more postures that are standing, and 4 from Mahalape, including our 2 incredible World Spine Care clinical assistants, Cabello and Marcia, who are incredible teachers and whose level of commitment to the yoga project's success and World Spine Care as a whole is beyond commendable, so thank you, you two. And they will be the yoga project's go-to leaders in Botswana moving forward. We have trained and graduated 7 new level 1 teachers in Mahalape, and they range in age from 17 to 76. We have also begun offering the protocol to yoga instructors in the United States and Canada to great success, and because those communities also asked for something that could be brought to low mobility communities. And we've trained over 60 yoga instructors who are interested in bringing these practices to their communities. So why is it unique? We are capacity building. We build from the ground up, addressing unique requirements. We have direct measurable outcomes, and we continue to collect data. We are in collaboration with a major health organization, which makes us one of the only training programs of its kind around the world. And this model is continuing to expand in hopes of reaching millions of people worldwide, old, young, rich, poor, who are suffering from musculoskeletal pain and limited mobility, all who could benefit from yoga. Tomorrow at 7 a.m., if you're willing, we are going to have a community yoga class. And we actually will be using the chairs. So if you have some sort of clothing that you can move in, so maybe not skirts, and shoes that either have good grip but not high heels, or bare feet is fine. And we will get up and get moving, so even though it's around a chair, it does require some musculature. But as always, it will be for all levels of people. And then tomorrow, from 10:45 to 12 p.m., I'll be offering a breakout session teaching the practical application of breath and mindfulness, some exercises, postural exercises that you can offer within the clinical setting to help with stress management and anxiety specifically. Thank you.